This video will discuss 2 training tools to help you select appropriate respiratory devices for your patients and teach them appropriate inhaler technique. Objectives for this video include to review the purpose for each device, to help identify patient situations where they may be helpful, to describe correct use of each device, to compare and contrast the inspiratory rate of the various DPIs, to list advantages and disadvantages to each device. Other videos in this series have discussed the importance of inhaling at the optimal inspiratory rate for adequate drug delivery. The ToneTrainer helps patients learn the slow, deep breath required for a metered dose inhaler, or MDI. The in-check dial is useful in assessing if a patient is able to achieve more rapid inspiratory rates in order to use various dry powder devices, or DPIs, effectively. For any of the inhalers, using the optimal inhalation rate is very important for maximal drug delivery. For metered dose inhalers, if one inhales too rapidly, the drug will impact on the back of the throat. The drug will be swallowed instead of reaching the lungs. Even with excellent technique, only 15 to 50% of a dose from hydrofluorocarbon, or HFA inhaler, will reach the lung. Learning the correct inhalation rate can be challenging. Many patients inhale medicine from MDIs too quickly. As a result, the effectiveness of their medication can be significantly diminished. The ToneTrainer is designed to help patients learn to use the correct inhalation rate for metered dose inhalers. The optimal inhalation rate for an MDI is about 25 to 60 liters per minute. When inhaling on this device, there are 3 possibilities. The first is that no sound at all will be heard. This means that the inhalation rate is too slow. Let me demonstrate that now. Secondly, if one inhales too fast, 2 tones or a chord may be heard. That sounds like this. Lastly, if one clear tone is heard like this, you are inhaling at the right rate. With repeated practice, a patient can learn the right rate. There are 2 ways a healthcare professional might use this device. You can use this device with an adapter and a disposable mouthpiece to initially teach patients MDI technique. For infection control purposes, patients should not exhale into the device. The mouthpieces do have a one-way valve. Even so, the device should be cleared in between patients. Follow any policies by your infection control department. An alternate method is for the patient to purchase their own device. After initial instruction, the patient takes the device home. They practice inhaling on the training device once or twice before actually inhaling each dose of medicine. After they feel comfortable with the correct rate, they continue to use the trainer weekly or monthly to be sure that their inhalation rate is still correct. This device should be kept away from dust, excessive heat, or moisture. Once monthly, wash the device with warm water and mild dish soap and rinse. Shake thoroughly, then allow it to air dry. Replace the device if it becomes damaged. Advantages of this device. Rapid inhalation rate is a significant problem. It is especially problematic in patients using both dry powder and metered dose devices on a regular basis. The very different inhalation rates can be confusing. Young children just learning to use inhalers. Retention of correct technique tends to fade over time. This gives the patient a way to gauge their technique at home. This provides the healthcare professional with an objective versus subjective assessment of the patient's inhalation rate. The device is developed for home use, is compact, and is relatively inexpensive, under $20. The ToneTrainer is available from a medical supply store or can be ordered on the internet. It does not require a prescription. Limitations of this device. It is an extra expense to the patient to purchase for home use. There is a slight extra cost for the disposable mouthpieces if using in a clinic setting for multiple patients. If the patient was using a holding chamber with a flow signal or whistle, it would likely accomplish the same thing without the extra expense. Patient adherence. Does the patient need to continue to use it over time? Using this device has been shown to improve technique from baseline. The ToneTrainer only assesses inhalation rate. Inhalation rate is important, but there are many other important technique errors that significantly affect drug delivery. For example, the depth of the breath, duration of the breath holding, and the timing of the activation of the puff to inhalation of the medicine. The ToneTrainer does not address any of these other issues. So, use of this device does not replace observing the patient's actual technique.